Barbara Gottlieb. I'm the Director of Environment and Health at Physicians for Social Responsibility. Thanks for being with us tonight. Thank you, Julia. Tonight's webinar is one in an occasional series of webinars on the health impacts of fossil fuels and the health benefits of clean renewable energy. Our focus tonight is fracking infrastructure. Many of us are aware of the health impacts of fracking on the communities where fracking takes place. What has become clearer over the past couple of years is that the infrastructure that transports fracked gas, especially the pipelines and compressor stations, extend those health effects far from the well site. So that's what we'll be hearing about tonight. There are several things you should know about tonight's webinar. First of all, we're going to focus on fracking infrastructure in New York State. That's because PSR National and the PSR New York chapter are in the process of identifying health professionals in New York who are willing to learn about the issue, then provide their health voice to inform and support the community-based organizations opposing construction of this infrastructure. At the same time that our speaker will focus on New York, you can be sure that what you hear tonight will be applicable in many states, and you can take it as a case study that you can apply elsewhere. Because that is our purpose, tonight's webinar is designed for health professionals. Those of you who might not be health professionals are welcome to be on the call, but the presentation will make certain assumptions about the type of content that our target audience needs. So the content is science-based. Our sources are factual and, where possible, peer-reviewed. The presentation will be dense and it will move quickly. At the same time, we want to leave plenty of time for question and answer. So for that reason, and differently from most of our webinars, we do expect our webinar tonight to run more than 1 hour. We felt that was important both to do justice to the wealth of content that our speaker will present and also to do honor to you, our audience, by leaving you plenty of time for questions. And here's how we'll do the question and answer. As questions occur to you, please write them into the question box that you can see on the dock on the right-hand side of your screen. We'll start the presentation at about 7:45, and I'll call on people by name to present your questions. Julia Morgan, our webmaster, will unmute you so you can speak your question. You'll be muted again. One last note, this presentation is being taped. We'll post the tape online tomorrow, and we'll send out a link to everyone who's registered so you can have ongoing access to this valuable information. Without further ado, I'd like to introduce tonight's speaker. Could we have the next slide, please? Our speaker tonight is Dr. Larissa Driska, a board-certified pediatrician and former director of pediatrics at Holy Name Hospital in Teaneck, New Jersey. Dr. Driska is a graduate of Washington University School of Medicine in St. Louis. Following her residency and board certification in pediatrics, Dr. Driska practiced general pediatrics and, as I just mentioned, held the position of Director of Pediatrics at Holy Name Hospital in Teaneck. Her recent work has been focused on children's rights with a conference of NGOs at the United Nations Committee on Children's Rights. She's been a State University of New York Sullivan Community College Board of Trustees member since 2009, appointed by Governor Patterson. And since 2008, Dr. Driska has been a strong advocate for health on the issue of gas exploration and production. She's a founding member of Sullivan Area Citizens for Responsible Energy Development, Vice Chair of the CME Curriculum Committee for Physicians, Scientists, and Engineers for Healthy Energy, and on the board of the Physicians for Social Responsibility chapter in New York. Together with fellow New York medical colleagues, she founded Concerned Health Professionals of New York, which is an organization PSR has had the pleasure of collaborating with. Dr. Driska, it's all yours. Thank you very much.
Thank you very much, Barb. Okay. There's a huge network of infrastructure projects which has sprung up with the evolution of the gas and oil industry, and it affects states that have permitted gas drilling and those that have banned it, like New York. The ban on fracking in New York has not stopped the explosion of infrastructure projects in our state. Environmental problems and adverse health impacts have been observed during all the steps of unconventional oil and gas development, and it's not just during fracking. I'd like to point you to an excellent site to view the build-out of infrastructure, and that's fractracker.org. You can click on maps and then New York or another state. So while the focus of this talk is New York, because we're most familiar with it, the environmental and health problems that are encountered with infrastructure build-out are global. And after a brief overview of infrastructure, because time is limited, I'll focus on the health impacts of compressors. Large quantities of silica sand are used during the hydraulic fracturing process. At this time, it's mined mostly in the upper Midwest, where it threatens both air and water quality, and it has transformed rural areas into industrial zones with complex public health issues. Silica dust is a known cause of both lung cancer and silicosis, which is an incurable and painful lung disease. The Occupational Safety and Health Administration has recently proposed rules to limit crystalline silica, but that's only in workers. Of course, that would prevent 700 worker deaths a year. But exposures to downwind communities and those, for example, at train transit depots, such as was proposed in Horseheads, New York, and the public health risks from living near frac sand mining and processing facilities are not being documented by any health agency. In 2011, the owners of the Wellsboro and Corning Railroad proposed to buy water from the village of Painted Post, New York, and then to sell it to Shell Oil for hydraulic fracturing in Pennsylvania. A lawsuit was filed to prevent this by several organizations, the Sierra Club, People for a Healthy Environment, the Coalition to Protect New York, as well as 5 individuals. And their attorneys argued that large-scale withdrawals could have negative effects both on the aquifer and water quality, and they maintained that the compact which regulates water withdrawals and a basin of which this area is a part should study the cumulative impacts of multiple municipalities withdrawing large amounts of water from aquifers and exporting that water out of state. Of interest, because where I live is in the Delaware River Basin Commission, we had paid attention to New York's Attorney General's suit of the Delaware River Basin Commission because, and it supplies water for New York City, for issuing water withdrawal regulations without a cumulative study of gas drilling. And a few months ago, the New York Court of Appeals, the highest court in New York, unanimously ruled in favor of the petitioners and against the village of Painted Post, and so no further water withdrawals will occur at this time. So that was one victory for the people of the state of New York. If it's extracted and produced, shale gas or its products need to be stored. One such site is the Energy Gas Storage Facility proposed for the salt caverns on the shores of Lake Seneca. The energy company needs approvals from the EPA and New York State DEC to reuse the salt caverns as underground warehouses for liquid petroleum gas, or LPG. Fact is, there was seismic activity in the past and the roof of the cavern has already collapsed. Jacoby, who has done extensive research on faults and fractures, has documented faulting in this area. And very importantly, this is the drinking water reservoir for 100,000 people. Disasters at storage facilities or salt caverns are not rare, and instances of environmental sequelae include Porter Ranch in California, Bayou Corn in Louisiana, and Lake Peigneur, among others. In the waste is extremely salty brine, which is at least 5 to 10 times the salinity of the sea. After all, the shale was the bottom of a sea millions of years ago. And in the shale are naturally occurring volatile organic hydrocarbons such as benzene, ethylene, toluene, and xylene, and radionuclides, which cause cancer, reproductive problems, and neurological issues. Shales, more than any other kind of rock, trap heavy metals such as lead, arsenic, barium, strontium, and chromium. And when shale is fracked, these heavy metals, volatile organic compounds, and radioactive elements are released and brought to the surface with the gas and produce fluids. So what to do with the waste? Currently, the waste disposal is via underground injection wells, which have been known to cause earthquakes, dispersed on soil farms, road spreading as de-icers and dust control, and wastewater treatment plants. In New York, Chemung County Landfill has accepted the most solid waste from gas drilling operations in Pennsylvania, about 200,000 tons. The second largest recipient, Allied Waste in Niagara, has accepted more liquid fracking waste than any other landfill in the state. And land spreading of sludge from wastewater treatment plants is another way radioactive elements from gas drilling wastes can contaminate soil and air and enter streams and rivers and the food chain. The land spreading operation in the town of Bath is the largest in New York State and is permitted to accept biosolids generated by municipal wastewater treatment plants in New York and Pennsylvania. Deep well injection is a method of liquid waste disposal which is approved by the EPA, and that's underground injection wells type 2. Disposal in underground injection wells can and has caused earthquakes, and I have some references there for you to use. In the future, Barb can post the PowerPoint in PDF form, and you'll have access to this so that you can click on the links and be able to access these references. In this slide, there's a conservative approximation in the picture on the right-hand side of the actual number of fractures and faults present throughout New York State, assembled by Jacoby. New York has only 6 active injection wells, so drillers truck their brine usually to one of Ohio's 159 state-regulated injection wells, where they have witnessed an upsurge of earthquakes. 18 states or territories have no Class 2 injection wells, which includes states like Arizona, Maryland, New Jersey, and North Carolina. And the states with the most Class 2 injection wells are Texas with 52,000 of them, California with 47,000, Kansas 15,000, and Oklahoma 10,000. I recently traveled to West Virginia to speak with impacted people and also to see some of the infrastructure, and that build-out is immense, as you can see from an aerial view of this fractionation plant. The information I'm going to cover about compressors is applicable to processing plants and fossil fuel power plants. As an example, again from New York, the now permitted 650 megawatt CPV power plant in Wawayanda will emit 2.1 million tons of carbon dioxide equivalents, 750 tons of VOCs, nitrogen oxides, particulate matter, and formaldehyde will be emitted annually. And to give a comparison, this plant will have 43 times the emissions of the nearby Minisink compressor station. Minisink has already reported an increase in health symptoms similar to those reported in frac fields, and the health impacts of power plants are magnitudes greater. This is to give you an idea of the massive network of pipelines which transport and distribute the increasing amount of gas and oil produced. The energy transportation network of the U.S. consists of over 2.5 million miles of pipelines. What's the purpose of compressors then? It's to push gas through, specifically to move through pipelines as a result of pressure, most specifically pressure differentials. They provide the force, and they're powered either by electric motors or by natural gas or diesel-fired engines. That compressors squeeze incoming gas and push it out at a higher pressure. Compressor stations are facilities that house the compressors and are built every 50 to 100 miles along the length of a transmission pipeline to boost the system pressure to keep the gas flowing. From permit applications, we know that compressor stations emit nitrogen oxides, which are associated with respiratory disease. Ozone is formed when nitrogen oxide and volatile organic compounds react in the presence of heat and sunlight. Volatile organic compounds are neurotoxins and have significant cognitive and behavioral effects. They are also known hepatotoxins, reproductive toxins, and phytotoxins, and all are dermatotoxins. Formaldehyde is a carcinogen. Sulfur dioxide is associated with respiratory and neurological illness, and particulate matter, because of its small size, carries toxic pollutants deep into the lungs, and it has also been recently classified as a carcinogen. Accidents can occur at any point of gas production, from transport of materials to the site, to construction and operation of the facility, to the processing of the gas and the delivery of it via pipelines. At any of those points, explosions as well as accidental release of air toxins are possible. On this slide is on health and safety, which you can refer to later. The oil and gas industry is working to extract as much fossil fuel as they can. To succeed, they need ways to transport their explosive fuels, which is why they're pushing new pipelines and increased crude oil by train simultaneously. Right now, there are more than 1 million barrels of oil per day crisscrossing the continent by rail, and if expansion continues at this pace, there will be even more in the coming years. Many of the U.S. crude oil by rail terminals operate as what's called master limited partnerships, or MLPs. These companies avoid corporate level income taxes entirely and distribute cash to shareholders on a tax-deferred basis. So this translates into a massive subsidy for these operations. In addition to externalizing the cost to taxpayers by subsidies, recent pipeline spills and train accidents show that transporting gas and oil by pipeline or oil train is not safe. Injuries, deaths, and burned buildings and contaminated environments are additional burdens shouldered by the residents. The deadly incident at Lac Mégantic was indicative of a disturbing aspect of the ongoing North American oil boom. And there were 117 crude by rail spills in the U.S. in 2013, which is nearly tenfold increase from 2008. On the Price of Oil site, you can find links for the maps of oil trains and terminals operating and planned. In New York State, there's a proposed Pilgrim pipeline, which would hold 2 pipes in a single trench, one carrying volatile Bakken crude oil south to New Jersey refineries, and the other refined products such as gasoline, kerosene, and diesel north to Albany. Pilgrim claims the pipelines would each carry 200,000 barrels per day, and they plan to build associated compressor stations, pump stations, and metering stations. But most towns in the path have passed resolutions or ordinances against this pipeline. In the short term, safety standards for pipelines and train cars are needed to protect communities, but in the long run, there's a need to transition to clean energy solutions that don't blow up. In the past year, there have been numerous applications made to FERC, which is the Federal Energy Regulatory Commission, the federal agency in charge of permitting export terminals, largely due to the projections of increased gas volume, perhaps inflated, and also because gas can bring a lot more money from the international market. The bottom picture is a representation of an LNG tanker. The orange structure is one big ship pulling out of a harbor past 4-story townhomes. LNG terminals are a security risk. Their security and their existence will increase unconventional gas development and increase the price of domestic gas. Fortunately for us in New York, Governor Andrew Cuomo recently vetoed Port Ambrose, a proposed liquefied natural gas terminal off of Jones Beach. However, other states have not been so fortunate, and projects are quickly being approved. The impacts of all this infrastructure is an exacerbation of climate change, and climate change impacts human health, documented, for example, by Dr. Sheffield and Landrigan and others. I have references here which you can click on and read in more depth. This range of studies has shown high levels of methane leaks from gas drilling, fracking, storage, and transportation, undermining the notion that natural gas is a climate solution or a transition fuel. These studies, some of them cited here, and others are in our Concerned Health Professionals of New York compendium, have concluded that the early work by the U.S. EPA greatly underestimated the impacts of methane and natural gas drilling on the climate, and that drilling, fracking, and the transport and expanded use of gas threaten not only to exacerbate climate change, but also to stifle investments in and the expansion of renewable energy. Narrowing in on pipelines and compressors, these are pipelines in the Northeast and in New York, and an example of a pipeline project, one of many in New York, and happens to be where I live in Sullivan County, that includes additional and new compressors, a pipeline, and an expansion of a metering station. This size compressor can be expected to release about 125,000 tons of pollutants into the air each year, including the known carcinogens and neurotoxins I've mentioned. On this slide is a comparison with a few other New York State compressors. In the pre-filing application, they did not list the tons of pollutants to be emitted per year, nor was there a description other than the number of horsepower, but based on the number of horsepower, which is 22,400, and comparing it to similar gas-powered compressors in New York State, this is the estimate of total annual pollutants for the town of Highland compressor. As I mentioned, there's going to be a similar one, additional one placed in the town of Hancock, which is only 25 miles away, and Minisink is only 25 miles in the other direction. In the environmental assessment for Minisink, they did not do an environmental impact statement. It was not deemed necessary. The FERC agency did not deem it was necessary. The standards for the air emissions used modeling rather than direct measurements, and based on the modeling, FERC wrote, quote, the Minisink compressor station would not be a major source of air emissions under federal air quality permitting programs. In addition, the total potential emissions from the proposed station would comply with EPA's NAAQS in accordance with the Clean Air Act, and that's the end of the quote. So basically, they considered this compressor in Minisink safe. However, I will show you data from a pilot study in Minisink which shows quite the opposite. Let's go to what other studies have shown about air emissions from compressors, and that is the volume of emissions from compressor stations is significant. The 2013 RAND study of air quality damages in Pennsylvania has determined that 60 to 75% of the estimated damages, mostly due to health problems, result from compressor station activities. And Dr. Alan Robinson of Carnegie Mellon University estimates that the greatest nitrogen oxide and VOC emissions are from compressor stations. On this list are the components of natural gas and pipelines. The sources are emissions and waste from various sources at the compressor station and involved in the transport. And also flaring, venting, and leaks. The infrastructure includes compressor engines and blowdowns, condensate and storage tanks, glycol dehydration and amine units, separators, and fugitive emission sources. 90% of individuals reported experiencing odor events from these facilities listed here. And children and pregnant women are particularly affected in adverse ways by environmental toxins. Children are especially vulnerable to air pollutants because their lungs continue to grow and enlarge until about age 18, plus they breathe faster and are closer to the ground. Air pollution has been shown to be associated with birth problems, neurodevelopmental disorders, lower IQ in babies born to mothers with polycyclic aromatic hydrocarbon exposure during pregnancy, and learning disorders in exposed children. A recent Harvard public health study linked an autism spike to air pollution. Children whose mothers were exposed to high levels of fine particulate pollution in pregnancy have up to twice the risk of developing autism as children of mothers breathing cleaner air. The greater the exposure to fine particulates, the greater the risk. Overall, although the evidence is just emerging for an association between air pollution and low birth weight, birth defects, and neurodevelopmental problems, there clearly is the trend of association of pollutants at some points with some pollutants at some points during pregnancy and early childhood. And these findings clearly demonstrate the need for additional studies as the public health implications of increasing the number of premature and low birth weight babies as well as children with autism and birth defects are enormous. Recently, I met several families from West Virginia and Southwest Pennsylvania. One family with 4 children was living near gas wells and several compressor stations. Numerous air toxins were documented around their homes. Over the course of the previous year, the boys' behavior had deteriorated and they developed movement disorders requiring treatment with anti-seizure medication. The adults in the family developed anxiety and depression, also requiring medication, and a teenage daughter was found to have suffered a mouth. All these neurological problems could be associated with air pollution, but no state or federal public health agency has investigated. In addition to the health problems, there is the cost to the government and the taxpayer. Disabled because of environmental exposure is not only a tragedy for the family, but a significant cost for the state. In a review by Dr. David Brown and his colleagues at Southwest Pennsylvania Environmental Health Project, they note that human health risks near gas development sites are derived from average population risks without adequate attention to the processes of toxicity in the individual body. Current methods of collecting the emissions data as well as the analyses of these data are not sufficient for accurately assessing risks to individuals or protecting the health of those near gas development sites. Community-based research has provided an important supplement to state air quality monitoring programs. In one such study, Dr. Carpenter found that air concentrations of potentially dangerous compounds and chemical mixtures are frequently present near oil and gas production sites. And in this slide, you see the relative amounts of emissions reported by PADEP for all sources and also for blowdowns at compressors. And in these photos, you're seeing thermal emissions with special infrared cameras called FLIR, F-L-I-R. You can't see them with the naked eye. Although most of the residents living nearby don't have access to these cameras, they feel the health impacts. The most common complaints associated with the oil and gas activities that I've noted in people living near compressors include skin rashes and irritations, or ocular problems, gastrointestinal problems, such as pain and nausea. Respiratory problems include difficulty breathing or coughs, upper respiratory congestion, sore throat and nosebleeds, neurological problems, especially headaches and less frequently movement disorders and dizziness, psychological problems like anxiety, depression, stress, and irritability. The long-term consequences, which will take some years to appear because of latency, include cardiovascular problems like heart attack and high blood pressure, respiratory problems, neurological, birth defects, cancer, and premature mortality. Colleagues of ours have published a series of cases in a peer-reviewed journal. In one of the homes, a child became ill with confusion, abdominal and back pain. After several animals in the household had died, the doctor tested for toxins and it revealed arsenic in his blood. The family then stopped drinking the water and he eventually recovered, but he lost a year of school. There were 25 wells within 2 miles of the home. There was an aerated impoundment and 2 compressor stations within a mile. Other family members had phenol, which is a metabolite of benzene, in their blood, and their symptoms included extreme fatigue, headaches, nosebleeds, rashes, and deficits of smell and hearing. Were it not for the deaths of the animals, the human health effects would not have been diagnosed. This was reported by Bamberger and Oswald. And there are other cases, and they fit the criteria of having been impacted by an environmental toxin nearby: a temporal relationship, plausible exposure, and absence of a more likely explanation. Wilma Subra did these surveys in Louisiana, Texas, and Pennsylvania, and she reported the health impacts on community members living near these compressor stations and gas metering stations along transmission pipelines. 61% of health impacts recorded were associated with chemicals present in amounts that were in excess of short and long-term health screening levels in the air, and that list is here. And the most prevalent conditions in individuals living close to compressors and the percentages reporting these symptoms were as indicated on the list on the right. 90% of individuals living and working within 2 to 3 miles of compressor stations reported experiencing odor events and health impacts. At Southwest Pennsylvania Environmental Health Project, the clinicians were observing symptoms in people living near gas development, and those symptoms could be either persistent, transient, or intermittent. These variations in symptom presentation could be consistent with the changing and episodic nature of exposures. The graph is a screenshot of a SPEC particulate matter monitor 12-hour report. Of course, the spike indicates a high level. One would expect that symptom severity correlated with the height of the particulate matter measurement, and it did. Southwest Pennsylvania Environmental Health Project researchers reviewed the data that they had previously collected. Particulate matter was used as a marker for all the emissions from the compressor. SPEC or DLOS monitors measured the particulate matter, and the symptoms were assessed and plotted against the peaks. And they found a correlation between the number of symptoms and particulate matter peaks. In other words, they found that the number of peaks related in a linear way to the number of symptoms. The higher the particulate matter monitor readings, the more health symptoms were observed. But this is not what government agencies like Pennsylvania's Department of Environmental Protection and the City of Fort Worth have reported. And one of the reasons is because they don't measure such peaks and they don't assess the health data adequately. The Southwest Pennsylvania Environmental Health Project mini-sink pilot project on compressors was a response to a community need and a request for an accurate assessment of exposures and health impacts, since what they were experiencing as far as health impacts was not in sync with what FERC, the EPA, and state agencies were modeling and then stating that there should be no health impacts. Please recall that FERC uses models and predictions, in other words, conjecture, to arrive at their conclusion. And it's important to say this again, that they're done by the company or government agent sampling basis, and they're not continuous. The Southwest Pennsylvania Environmental Health Project proposed to include community participation, a health professional to do individual health assessments, continuous monitoring for particulate matter both inside and outdoors, and episodic VOC sampling with SUMA canisters. Individual health assessments were completed on 8 families in Minisink. We filled out 35 health intakes, 12 of which were for children, and it's the most complete set of intakes from a community yet collected by any group looking at infrastructure health impacts, which tells you the early stage of this research. The residents were given and instructed on SPEC particulate matter monitors to document indoor and outdoor particulate matter. The reading showed significant recurrent spikes in the amount of particulate matter. The spikes tended to occur at night when stable atmospheric conditions hold particulate matter low to the ground. Based on the residents' health diaries and individual health assessments, we concluded that it is likely that the spikes in airborne particulate matter are causing acute health impacts in community members. In reviewing the health data, we found an association between respiratory and neurological effects, specifically headaches, which appeared to be occurring together in this group, dermatological symptoms, rashes that come and go and appearing to be allergic, also appeared in about 1/3 of the intakes, along with concerns about health and related stress. To summarize the health findings, the predominant health impacts reported were 22 with respiratory problems, 12 with neurological problems, 10 with dermatological problems. And on the SF-36, which is a standardized self-assessment, the overall mental health and well-being levels were below normal for half of the respondents. Based on the monitoring results and health intakes, Environmental Health Project concluded that families living near the Minisink compressor station are exposed to elevated levels of PM 2.5 when compared to the regional AQI, which is the air quality index. SUMA canister sampling revealed additional chemicals present in the air near the monitored homes. And further, the episodic nature of the health symptoms reported is likely associated with the episodic high emissions that come from the compressor station. And it's supported by the periodically high levels of PM 2.5 recorded by the SPEC monitor. In this slide, the SPEC monitor documented exceptionally high levels that would not have been captured if averaged over a 24-hour period. The horizontal colored lines correlate with EPA air quality index levels, and the blue dots show the hourly spikes. The yellow line is the level at which sensitive individuals could be affected. And the data is presented in graph form here, showing the episodic high levels of particulate matter documented outside multiple homes. It's clear that the recorded peaks were not captured by the AQI daily average, the numbers on the right, nor would they be, since it is a 24-hour average for the region and not for the local area. During the monitoring period, the SPEC monitors recorded at least 3 times the regional average of 6.3 micrograms per cubic meter and regularly beyond the Environmental Protection Agency limit of 12. Multiple episodes of peaks into the hundreds were also recorded by the SPEC monitors. In a study published in June by Harvard epidemiologist Joel Schwartz and his colleagues, he identified the dangers of PM 2.5 even above 6. Each increase of 1 microgram per cubic meter increases the mortality rate by 1% for people over 65, they found. To obtain permits, pipeline companies use analysts who manipulate projected emission levels to make them acceptable by EPA standards. Dr. David Brown of EHP, who led the Minisink study, said that since Minisink has only a compressor and no gas wells, his group would be able to sort the data and to determine what symptoms can be traced to compressors. EHP is currently in the process of gathering additional information on several compressors in New York, and that includes the counties of Madison, Niagara, Montgomery, Rensselaer, Schoharie, and Sullivan. And these are the study goals: to assess the residents' health before, during, and after construction, monitor the environmental factors, and to analyze the results. And here are the assessment parameters that they plan on studying, both environmental and health. This is the timeline and the study population, and a summary of the basic model. Of course, given additional funding and interest, this can be expanded in the testing and the what tests are done, as well as the distance studied. In the previous slides, you'll notice that I had starred some items, and those are for Madison County, which is doing much more extensive testing because of the funding that they've been able to acquire. In that expanded model, such as Madison counties, they'll also be looking at radioactivity, radon specifically. We've known for decades that the shale is radioactive, particularly the Marcellus Shale, and the pipeline carries the gaseous radon with it, and as the radon decays within the pipeline, the solid daughter elements, polonium and lead, accumulate along the interior. Lead causes neurologic and hematologic toxicity, and polonium causes cancer and death. And there's a concern that the gas transiting and being compressed will have radioactivity levels that will be a risk not only to the workers, but potentially also to the residents. In the PADEP TENORM report, in the appendices, you can see the actual readings at various gas sites, including compressor stations, and those numbers are elevated. This is all confirmed in a description from the 2008 publication of the International Association of Oil and Gas Producers. And the lower graph from that publication shows how NORM can actually accumulate. Pipeline inspection gizmos are those structures on the upper part of the slide, are used to inspect or clean out pipes, and they become repositories of the toxins like the radon decay product, polonium and lead. So another source of exposure to radioactivity. Pigging stations are typically put in near large compressor stations, or even as separate sites, and several of these are being planned in New York. The residents here live 50 feet from the compressor station, which is collecting not just the air emissions, but also in the condensate tanks behind them. There is waste, which they not only sense, but have experience some health impacts from. And we know that there will be community impacts, air impacts, and impacts on water and the agricultural land. For example, in Minisink, Minisink is what's called the black dirt area. a very rich agricultural land. Homes near compressor stations will likely be devalued. Tension within the community can rise because some will benefit, very few will benefit, and most will have problems. There will be a lot of noise, which can cause vibroacoustic disease. It raises the risk of heart attack and high blood pressure, and the risk of cognitive deficits in children can interfere with the ability to learn, and that's been reported by the World Health Organization. And besides the feeling of helplessness and hopelessness, there's a feeling of abandonment from state and federal officials who've helped very little in protecting their constituents' health. All of this can lead to stress and depression when the fabric of the community unravels and people's health suffers in a county, like for example, Sullivan County, which is 61st of 62 New York State counties for health outcomes. And you can read more about the solastalgia on the next, in my presentation that will be in PDF form. There's a number of reasons why we don't know more about who will get sick and how far the reaches are of, for example, compressor stations, because most of the literature on health impacts have just been published, starting to be published on fracking in the last 2 to 3 years, and on compressor stations and other infrastructure just beginning. And they haven't been, these studies have not been included in the regulatory process. Federal exemptions limit information at the national level. Doctors aren't usually trained in recognition or investigation of environmental exposures. Vulnerable populations like children and workers haven't been adequately addressed, and the community needs to be looked at more closely. We also don't know because non-disclosure agreements are very common, and we need comprehensive studies that includes all of this. But where there's political will to be advised by results, there is a process that could bring public health to the table. And like an environmental impact statement, a health impact assessment is recommended to be done before issuing permits. It's a process that can, the health impact assessment is a process that can be used in any land use decision to determine how human health will be impacted by the specific land use. It's very similar in the steps to an environmental impact statement, except that it's all about health. It elevates the role of health in decision making. The Medical Society of the State of New York and the AMA have now recommended in resolutions the use of health impact assessment in decisions about infrastructure. My colleagues at Southwest Pennsylvania have concluded, and I agree, that we can glean the following from our studies. People are exposed to toxics through air, water, and soil, and the exposures are periodic and they're intense for several hours, but the regulatory air and water screening have not detected the hazard. We know what the most likely physical symptoms are, but more biomonitoring needs to be developed, and interventions supporting the patient cope need to be available. And individuals must take some responsibility to monitor. But most importantly, the public health process has become rule-bound, restricted to standard environmental tests and research health protocols, and they don't have, regulatory agencies don't have the flexibility to monitor health and environment appropriately. So what can you do? You have a right to ask in New York State, the DEC and FERC for hearings and for adequate time for comments. And I would urge that a cumulative environmental impact study with health impact assessment be conducted prior to making any such decision about locating any compressor or any infrastructure project, because the evidence is pointing to significant potential health issues, and it's wise to have all the information. You can request baseline and during and post-construction measurements of air emissions, methane, radon, and water, especially health. The cumulative emissions need to be included. You need to ask for best technologies, which includes electric compressors instead of gas-powered or diesel-powered, and a hazardous materials management plan to include a norm management plan and also emergency evacuations. So these are some sources of additional information, and thank you, and I can take any questions that you have.
Thank you, Larissa. That was a powerful, somewhat overwhelming presentation of a very challenging issue. We have our first question by Yuri Gorby. Julia, may I ask you if you could unmute Yuri Gorby and he could present his question himself?
Well, hi, yes, thank you very much. Hi, Larissa, this is Yuri.
Hi, how are you?
Well, I'm doing quite well. Thanks again. Larissa, I mean, so impressive what you presented here, and in such a way, I mean, I've been actually just writing an email to you, just noting that anyone that's really listening to this could conclude, no way could they conclude that continuing this type of operation, the infrastructure development related to unconventional gas and oil development, it seems to be I mean, there's no lack of evidence at this point to conclude otherwise, that this is an unsafe practice, both for people that living near these infrastructures and ultimately for the rest of our species living elsewhere in the world. So I just want to have your comment. Do you think that there is sufficient evidence at this point to warrant a national and hopefully global ban on unconventional gas and oil development?
Well, New York has taken that step, and it was based on science. And yeah, I think it is time to for the rest of the country and the world to do the same.
Would it be the development of the infrastructure? Do you think that that it will take a growing awareness of not only how living near one of these compressor stations here in Minisink or a failing gas storage facility under Lake Seneca, but really, how do we unify the knowledge that the people living at the other end of these pipelines, those that are already suffering the effects of living near one of these wells, not only will it continue that suffering, but it will actually accelerate that. Isn't that true?
Yes, it will definitely affect the climate change. I think that it'll be by steps that one of which is what we're doing here today. PSR has been aware of this as a problem for a long time now, but we have to reach the downstream communities, including the health communities. So this is one step, that educational step, to share the information that we have. And they can take it further. Other people can use this presentation and present it to communities where they live. So we're hoping that it will be used and other people can use the information. Another step will be research. So what Environmental Health Project, together with the Institute for Health and the Environment at the University of Albany, Madison County Health Department, who've all allied to, who've committed to research, will give us a lot more information that we should have available within a year. And I know that you're also, that Yuri, I know you're going to have a presentation coming up soon at your college that will also share that information. So it's a matter of getting that message out there.
That's right. I actually, my email to you, which I think I have just pushed the send button, Larissa, I was wondering, you don't happen to be available that Tuesday, April 19th, when Tony Ingrafia and Scott and Nick, a list of people, I sent you an email, but I will advertise that, and we will, if it's possible, send a link to this presentation of yours so that people can view that prior to our panel discussion on the topic?
Yeah, unfortunately I won't be in the country, but yes, this is, hopefully this is one way that this presentation can be shared. Thank you.
Wonderful, thanks.
Barb Gottlieb here. Yuri, it's nice to meet you, at least electronically. Let me encourage you to send an email to me. You'll see my email address on a slide that will come up shortly, but it's b.gottlieb@psr.org, and I'll be very happy to share information about your presentation with PSR members in New York. Larissa, there's a question that says, we've heard about communities opposing construction of new pipelines in New York. What kind of support do they need? Can you comment on that?
Yeah, actually my community and my neighboring communities are currently involved in such resolutions and such opposition to the town of Highland compressor. We're fortunate that all of our town boards have passed resolutions of opposition to the compressor that is proposed for the town of Highland. I also have referenced the oil train, and it's not an oil train, it's an oil pipeline, the Pilgrim pipeline, there is a growing opposition, many towns opposed to that one as well. There are resolutions online. The Stop the Algonquin pipeline expansion has resolutions on their website that can be used to formulate your own town's resolution, and then you know, there is some education that needs to happen of the town board to inform them what the health impacts are and what the environmental impacts would be. But you can use this presentation if you need to share the health impacts. And if you need any additional information, please feel free to contact us. We can refer you to the people who have been writing these resolutions and the town boards that have passed them.
Thank you, Larissa. Our next question is from Gina Angiola. Julia, could you unmute Gina?
Hi, I was just wondering, you mentioned if they use best available technology for the compressor stations and switch from gas to electric. Do we have any data on what the actual toxic outputs would be under best case scenario?
Yeah, I actually did read a very good presentation, a very good paper, which, Gina, I have your contact information, so I can send that to you.
Yes, thank you. Thank you, Larissa.
You're welcome.
We have a question from Kenda Hanneman. Julia, can you unmute Kenda Hanneman?
Hi, thank you. I'm calling from Virginia. We are in the heart of Virginia, right in the center, and currently Dominion has raised the horsepower to 52,000 for the compressor station they want to put here, and likely going to raise it even more. It's up just recently. They've raised it another 25% from the last increase. We are really understaffed and underfunded, and just wondered if we could get any help at all from PSR.
Well, Barb Gottlieb here. Sounds to me like something we most definitely need to follow up with offline, but both PSR and our friends and allies in Alliance of Nurses for Healthy Environments are actually very interested in working in Virginia. So again, my slide will come up in a few minutes when we finish the questions. You'll see my email, and I hope you'll email me and we'll continue this conversation.
Thank you. I look forward to that.
Likewise. I'd actually like to say that for all of you who've been with us tonight, thank you very much for being with us. I'll follow up with all of tonight's attendees by email to see which of you are interested in getting further information on this topic, maybe some training, and would be willing to consider speaking publicly in your own communities or or even by webinar to communities a little bit further away. So you can look forward to that communication from PSR in next day. I think we have a question. We have a comment from Gina Angiola saying, "This was excellent. Thank you." Since I don't see any more questions posed, well, let me just put out one last call. If anybody has a question, type it in right now. But if not, Julia, could we have my last slide so people can see the PSR, excuse me, my PSR email? There it is, bgottlieb@psr.org. I also put in a little plug for PSR's campaign, Clean Energy Saves Lives. This is a campaign that I invite all of you to join. We do simple monthly actions to promote clean energy around the country. You can find that on our website at the address right there. I agree with Gina Angiola. This was excellent. Quite a powerful presentation. We will be posting it online tomorrow in taped form, and I believe that Larissa, I believe you were saying that you'll be sending us your slides as well so that people can view the slides. Is that the case?
Yes, you can post the PDF of the PowerPoint presentation, which will make the slides, make the links active so that people can look at, can view the references that are directly on the slide. Now, yeah, that's how we'll do it.
That is terrific, because that is quite a wealth of information. Obviously, your command of this material is based on a lot of study and familiarity with a lot of sources, so thank you very much for sharing that with us. Thank you for sharing all of your knowledge and expertise, and this concludes our webinar. Thank you and good night.
Good night.